Okay, it's 10 o'clock. I think we should just kick off. I'd like to welcome everyone to the Performance and Audit Committee of the 4th of February. And again, I'll just for the record, just welcome Nicholas Stephen, who's going to be subject to approval at the IJV, is going to be our future service user representative, hopefully. And so she's here in an observership capacity today. So thank you. Welcome then. And also welcome to Lynn Short, who's standing in for Siobhan. And welcome to Ross from Audit Scotland. Thank you very much indeed. Okay, are there any apologies I need to be aware of, Arlene?
Yeah, I've had apologies from Councillor Toland, Christine Jones and Jocelyn Lyle, but I think Barry's here for Jocelyn.
Right. Thank you very much for that. That then takes me on to item 2, declarations of interest. Are there any declarations of interest? Thank you. That then takes me to item 3, which is the minute of the previous meeting and action tracker. So could we check the minute for accuracy, please? That's the minute of the meeting held on the 24th of September. Any comments on that minute? No. In that case, we shall just take approval from the committee. Dorothy, do you want to come in?
Sorry, I might be a bit premature. I have a question about the minute. Is that coming later?
Is that as a matter arising?
Yes.
Okay. Okay, I'll leave it till we get to that part once the minute has been signed off. And
thank you.
Can we accept that the minute is an accurate record of that meeting? Just nod heads would do fine. Thank you. Thank you very much. And I think I'll take the matter arising just now, Dorothy, although we don't have this officially on the agenda, but I'm happy to take a matter arising, assuming it's not already on the agenda, of course, Dorothy.
Well, that's my query. It concerns the item on the Kingsway Care Centre, the roof, and it says progress would be provided at the next meeting, on mitigations would be provided at the next meeting, but I don't see anything on the agenda to cover that unless I've missed it.
I have a funny feeling that within the body of the reports there is reference to that, and Dave, can you assist us in this? But I'm pretty sure it's actually raised within the package of papers.
Yeah, it's probably not correct, explicit enough in terms of that kind of where we are in terms of kind of progress with that. But just to kind of advise the committee, there has been some kind of options appraisal discussions that have gone on, which has been kind of led by NHS estates and kind of health and social care partnership services around a kind of way forward around the Kingsway site, and there's a paper due to be produced within the next couple of weeks as a result of those. So we'll feed that back to future meeting in the park.
But thanks, Dave. I just have a memory of roof works pending or being in progress, something like that. Thank you, Dorothy. In that case, thank you for that. And then we'll move on to the action tracker. And who's going to take us through this again? Dave, is that you?
I was going to say, I think we'll just open it up for questions.
What I'd like to do, Dave, is actually go through each one systematically and sign them off formally, each one, just so that we can clear them or archive them or continue them in progress. David, do you want to come in? We've got number 1 here, which is the query around the performance report.
No, Bob, what I was actually coming in about was the fact that what Dave was talking about and Dorothy had raised is actually an action point, is on action point 15. It actually says there, it says Kingsway roof, what's the status says complete.
I knew I'd seen it somewhere. Thank you. Does that, Dave, does that contradict anything you've said so far? I'm not sure it does.
So it shouldn't contradict that, because it'll be within that particular kind of report anyway. So
yeah,
but, yeah.
Right. Okay. No, I get that, Dave, and thanks, David. I'd like to go back to the beginning again, rather than go through this piecemeal, actually, because there's some that I think we need to formally sign these off, so that we're not just dealing with them. So I'm scrolling down. The first one is a query about table 1, the West End, showing all that. According to that, this should be signed off as complete. Is that correct?
I think we're suggesting that it's no longer relevant and needs to be removed, Bob, because of the passage of time. And actually, it was historically there was not the same pattern of performance. This was a particular point in time, and since then also the performance has improved. So through the passage of time, and also the fact that it wasn't an established trend, we're suggesting that we can't prioritise resource for that and it should be removed.
Okay, that was my sense of that as well. Dorothy, I think it was you who had raised the query in the first place. Thank you. Do you want to come in?
Just to say, yes, I agree it should be removed. I think what happened, I think this was a blip.
Okay,
and not a trend or anything. So yeah, happy for it to be removed.
Thank you, Dorothy. So we can agree that that is now complete and can be removed. That then takes us to number 2, which is around drug and alcohol services. And that, who's speaking to that? Is that you, Catherine?
Yeah, I compiled the update for the tracker this time, so I can probably do most of these. Yeah, so we've added what information is available. Lindsay and Russell, who are both on the call, have had some conversations about that in terms of disengagement, and what information is currently available and reportable has been incorporated into the report. We do recognise that probably we don't have as much data and information as we would want about that particular indicator, and they are continuing to look at that in the service. But for now, we are providing you with all that we are able to provide you with in this forum.
Thank you. Can we therefore agree that that is now complete and can be removed from the action tracker? I just need a nod of heads, that's all. Thank you. That takes us on to number 3, which is again drug and alcohol services.
Yeah, so 3 and 4, Bob, probably go together. That was information that Councillor McHugh had specifically asked for, and I know that Lindsay provided some quite significant further detail regarding that at the time of the meeting. So unless there's anything outstanding from Councillor McHugh, then I think we've completed that one.
Dorothy, are you content for those items 3 and 4 to be removed as complete?
I am.
Thank you very much. That then takes us on to number 5, which is to do with the quarterly performance report. Ongoing further discussion required. Now, I have a note here, and I'm pretty sure there was something about we already got this on the agenda. Is that correct? So therefore, would that require an ongoing on number 5? Lindsay?
I don't think it's on the agenda. We have started to look at reviewing the performance reports that come to the pack. We have we take an iterative and developmental approach with the performance papers, but over the years, as membership changes, the requirements of the pack changes. So historically, we provided a lot of narrative and a lot of analysis. It was felt it was too much. We've pared it back, but I think we've not quite got the balance right for the current membership of the pack. So we're currently looking at that. We're starting looking at with mental health performance, and we're also looking at trying to improve our efficiencies in the service and reduce the processing of data. So moving more towards dashboarding approaches to presenting data, but that is very much in sort of early stage, and we will test out any proposals that we have with the pack as any proposals come up, to make sure that it is kind of meeting the needs of what the pack needs the performance papers for.
It sounds as though, from looking at item 5, that this is going to be ongoing for quite a long time, actually, because these are dynamic documents in many ways. Dave, do you have a view on this, whether we keep this on as an action point? Otherwise, it will just sit here for a long time. But it's clear that work has been done.
So yeah, I think it probably, I think it's one of these things that, you know, if the committee is willing to kind of just let us kind of continue to kind of work around that, and rather than kind of continue to kind of report back, but obviously you need the assurance that we're going to do that. So that would be my view on it.
And when we come to the paper that when we're talking about the performance report, we might add some of that discussion into that if you wish, because I think I'd rather see this removed as an ongoing piece of work. And maybe, Dave, just looking at this in terms of the kind of work itself, I wonder if there maybe is a worthy discussion round about quality data and intelligence. That is quite a big issue. And I know from my discussions with Catherine is that you've really got some kind of resource issues around this as well. And I wonder if perhaps we might want to incorporate that within a paper rather than look at it as a tracker exercise. And I wondered where you might best want to steer that. I think perhaps we might want to see that within future performance reports as being part of the narrative, rather than continue to look at this, because I think it's becoming a difficult issue for us now in terms of the quality of looking at what we're actually doing and getting feedback to this committee and to the IJV. Is my sense. Yep. My sense is to remove it as no longer, as it's ongoing, but I don't think we should continue to pursue this on the trackers. I think we should just archive it. Is the committee content with that? Thank you. That then takes on to 6. I think that don't think it needs any explanation. That's now complete, and we should remove that. Number 7, performance audit terms of reference. That's now complete. Just thinking, Dave, about this one. As you know, within NHS side, we've got quite a lengthy process around about revision of committee terms of reference. I wonder if we might want to take some learning from that, because actually I've actually found that to be quite helpful in terms of looking at the role of the committee as the work is progressing. So perhaps we might want to give ourselves the next time that this exercise comes up, which would that be November, we'd be looking at that again in terms of the review of the fact terms of reference. Is that the kind of time scale?
So I think that one was from the meeting on the 24th of September. So we're probably looking at doing a review.
Yeah.
And so yeah, probably September, but we're just going to do a review again on that, and that will be based on sort of kind of updated thinking around roles of performance and audit committees. We'd obviously take some advice from internal audit and external audit colleagues as well in that regard. So yeah, I'm happy to kind of pick up in September.
So I think it would be helpful if we had some kind of indicate. What comes to my mind here is that it would be useful if we had some kind of feedback from committee members about their experiences of the Performance and Audit Committee and any suggestions they might wish to make in terms of informing that future exercise. and just wanted to check with committee members if they would be content with that. I think it's quite helpful. I think particularly the environment we're moving into next year, I think would be more than helpful, actually, given so many changes that are happening. So can I suggest that we incorporate some kind of, within that review, some kind of feedback from fact committee members? Nothing complex, but something that could just enable members to comment on their experiences of the process and of the expectations that they may have. That can now be removed. Thank you. And then that takes on to number 8, the annual performance report. And yes, I think there were quite a lot of questions about the timescale of this. Is there any, I know this has been discussed. I don't think there's much we can actually do about the timing of this particular report, but Dave, do you want Catherine?
Sorry, Bob, the timing of the report is set in the primary legislation, and that is part of the issue that unfortunately is not in guidance or secondary legislation, that could be amended more easily, because the deadline does cause significant challenges around availability of data, but also the point in the year it lands and availability of meetings and members, etc. Bob, so it's not going to change, and there's a clear message that that 31st of July deadline is not going to change. So it's really about how we manage it in advance of that. We take advice from our legal service every year, and we'll continue to do that and look at whether there's anything further that can be done next year. But it's a really difficult interaction between the capacity we have in the team to produce the report, the availability of the data, and the availability of members.
Thank you for that. Are there any further comment on that one before I just seek to remove it? Can we now take that as a completed action and now remove it? Thank you, Dorothy. I know, Dorothy, you'd asked quite a lot of questions about that. Number 9, mental health services indicators. Can we now agree to remove item 9 as this action is now complete? And I have number 10 here, that an update on the Tayside Psychological Therapy Services. Now, I think there had been an intention that we would ring a paper on this, Dave. Can you give us an update on that?
Yeah, so thanks. So that we've put that now to May. I've got a kind of draft report. I wasn't quite ready in time for this committee on the basis that our new director of psychology only started employment with us in December. So he's been kind of working on that with me since then. So there will be there'll definitely be a report in May. I think it's probably fair to say, though, without kind of preempting what's in that there has been improvement in performance since the previous report on that. So that'll be displayed in May.
Okay, thank you for that. So we'll just keep that on. And number 11, drug and alcohol services indicators. So can we agree that further information on Dundee Recovery Network to a future IJV meeting? And that's scheduled for January 2026. So we can now have that as complete, and we can now agree to remove that. Okay. Then care inspector at gradings, registered care homes for adults, older people and other adult services. Information on substance misuse homelessness would be circulated to FAC members, and that is now complete and will appear in November. Oh no, wait a minute, that's out of date there. So that information has been issued to all IG members, so we can now actually see that as complete and remove that. And then there's the governance action plan progress report. And actually we have, looking at this, Dave, is our in our paper later on in this meeting, has that not been superseded now by that paper?
I think it's that one. I think it's fair to say that one does continue to be ongoing, because it's a large piece of work that we need to kind of still have kind of focus on. I suppose the question mark would perhaps be, again, similar to the kind of previous one around whether we take it off or not, is whether the board are content that, or the committee is content that we continue to kind of produce the governance action plan report, kind of progress report at each of the meetings anyway, but whether you want that specifically as an action, to continue to be an action around streamlining, or whether you just leave that to officers to kind of work through and further iterations.
I'm kind of minded to remove it, and I'll tell you why. Because I don't think it's specific enough. Actually, it's really like taking a length of string and wondering what we'd do with it. And actually, I think the reassurance from me would be around the favours themselves and the regular reporting of the governance action plan around progress. And I think we should leave it to that exercise. And if members are still and if there are any issues that are emerging out of that future reporting, then I think we should actually raise comment there rather than keep it on the action tracker. Are folk content with that? I think we now can take that out and just acknowledge that we depend on the progress report itself to give us those regular updates on that. And that's up to the scrutiny of members to make sure that that's done properly. So I'd like to see that removed. Then the internal audit plan, that's now complete. That's number 14. And actually, I quite enjoyed that meeting, I should say. And I think it's actually quite a cathartic exercise for anyone who chairs this committee, is actually to have those informal discussions with the audit teams. In fact, it's quite helpful. So thank you for that. And that takes to item 15. That's coming back to the Kingsway Care Centre. And I think we're deciding that that particular item is complete, but I think we're aware that from what Dave's saying is that there will be a future report on this at the next meeting. Did you say, Dave?
Yeah, so we should be in a position by the May meeting to have something back to committee in terms of an update on that.
That's not the next meeting, but anyway, thank you, Dave. Okay, that area is now complete. Now, before I go on to item 4, I've been asked by the author of the Dundee City report if they could come forward on the agenda, which I've agreed to. So the city plan. So could you take that forward? And I'm sorry, you'll have to work hard to get back to the city plan in your documentation. Peter, are you going to present this?
Yeah, if that's okay with my colleagues, I'll just quickly say thank you for taking us early. That allows us to get to another meeting. The city plan is the community plan update. It's a progress report, and what we tried to do from the Dundee Partnership as a whole is to invite people to take it back to their own individual agencies to take it through their governance body. So we're grateful that you and Dave picked it up at the last Dundee Partnership meeting. The overall report is that we're making good progress, and we describe in the report some of the important highlights of the work that we do, and every year there are some really positive examples of the work that we've done in Dundee, and we also try and flesh it out a bit by giving people access to case studies that describe some of the work in more detail. But one of the key parts of it, though, and this fits really well with your remit, is to identify areas for improvement and to delegate those to the strategic leadership groups within the partnership, so they know what they're meant to be doing to pick up performance. And each of the 3 SLGs did a presentation to the most recent Dundee Partnership group on the action that they are taking to try and recover the progress in the areas for improvement. There's not anything very surprising in the report. I think the issues that we're needing to do more on we're well cited on them, and they're reviewed regularly at the Dundee Partnership meetings. The work we're doing overall in this stuff is really closely supported by Catherine and my work with other leaders on behalf of the Health and Social Care Partnership. And Lindsay's doing a really important bit of work in terms of strategic needs assessment, which is going to be really influential in relation to the partnership's thinking and planning, especially as we move towards having a new city plan in spring, summer 2027. So you should receive one more report like this, which will be a progress report on this current year. And then we'll be working together to produce a new plan, which will influence the shape of the Dundee Partnership, the direction we're taking in the city, but it will take account of the priorities of the Health and Social Care Partnership. So I'm happy to take any questions, but thanks very much for taking the time to look at the report and for taking me on your agenda. Thank you.
And thank you, Peter. And this report has already been through the council as well, hasn't it? Thank you for that. So it's up for noting. So I'll take comments. David, Chief, and then Dorothy.
Yeah, thanks. As always, it's always a really interesting read the whole city plan update, and I'm particularly happy to see. So, I mean, as always, there's good news and bad news in it, and it's great, particularly focusing on youth unemployment and things, and the indicator there coming down it's by almost, I think, 2-3% in the year compared with the previous year. So there was lots of good news in that part, but to counter that, then we get the information on the number of workless households, saying that there were 14,300 in the year, an increase from 10,300. That's really concerning. Bearing in mind everything that's being put into to help with all of that. I know it's coming in the back of COVID, even up to December 2023. But it'd be useful if we could get, obviously by the time we get this plan, it's very much out of date. So it'd be useful if we could even get a verbal update as to where we have these key areas for improvement, where we are on the journey. It's not an official report yet, but what's it showing us now, as compared to the indicators, bearing in mind this was up to, I think it's 2020, well, that one was 2023, but it'd be good to see 2 years on how well we're achieving against these key indicators anyway.
Yeah.
As I say, Peter, it's a really interesting read.
Well, thank you.
But it's vastly out of date, by the time it reaches the pack. And, when you've got areas of concern like that, these ones, it's good to at least say, to highlight these to the committee and say, well, down the line from now, this is how it's moved, if you have that information.
Yeah. We have the constant challenge that the figures that are available for the plan are a bit out of date, but we always use the most recent ones. And then by the time we get through the process of getting reporting to the partnership and then the council and coming to you, it takes a wee bit longer. But we should be trying to make sure that if you've got any questions, we can get you an up-to-date reflection of where we are as a partnership. So we can do that. Thank you.
Thank you, David. Dorothy, and then Lynn.
Thanks, Bob. Yeah, this has been to council, so I'm not going to spend much time on it. I would like to draw attention to the work on child poverty. A marvellous work that's been done in Linlathen and Midcraigie, and I welcome the additional income that's come into these communities through this work. It concerns me a little that other areas, if you read the report, I think it's page 127 in our bundle, it tells us that funding or income that came into Linlathen and Midcraigie amounted to 538,000, and income that came into other areas was 760,000. Now, I'm happy that this money is coming into communities. That's absolutely wonderful. But I just wonder about the process here. If we're targeting two specific areas, and less funding came into those two specific areas than came into other areas across the city. So I think we might want to look at the process here, the targeting process. I don't know if you want to make any comment on that, Peter.
Dorothy, your sound cut out just when you were saying what money were you referring to? Is that the welfare rights income maximisation, or what was?
Yes, yes.
Yeah.
There was 760,000 came into other areas across the city, and 538,000 came into Lunlathen and Midcraigie, and this was a targeted project for Lunlathen and Midcraigie. So I think it's just it seems to me most of the money should have gone to Lunlathen and Midcraigie.
Yeah.
Not that I'm saying other areas don't deserve it.
No, of course.
I think the question's about the process, though. Peter.
Yeah, I mean, I'd like to speak to you separately about the figures, Dorothy, because I think my understanding might be slightly different, because my reading of that is that we've got an enormous proportion into what are two very small areas compared to the rest of the city. So I think that we've the level of targeting has been effective, but we might have to just have a chat about what the figures are representing and make sure that we're both on the same page, if that's
Happy
okay.
to do that, Peter, offline. That's fine. Thank you.
And it's worth noting, actually, from the community planning exercise that there's a very exciting Lunlathen project initiative, which I think is a game changer in many ways. However, I'll come back to that. Lynn.
Yeah, I think you've probably stolen my thunder there, Bob, because I was going to just mention the fact that we've had a recent directive that there's going to be a different way of looking at full family funding, and it was a report that came to the council committee, and I was just wanting to make sure that everybody here was aware of it, because presumably quite a bit of that funding will be coming from the Health and Social Care Partnership and the IJB. For example, I was speaking to Fairfield the other day, and they were telling me that the community nurses are down, and all the guys stand in line before they play their walking football to get their BP done, and they've picked up lots of opportunities where actually they're trying to get the BP down. So it was just to make sure that everything was there with you as a knowledge core, because as everybody has said, this is all very retrospective. And I think Dorothy was saying it's brilliant that Lunlathen has got all this, but what about the rest of the bairns and the rest of the city? Was that what you were trying to say, Dorothy? No.
No, the opposite of that.
Right, okay.
Okay, thank you for that, Lynn. And Dave, you had briefly highlighted, do you want to come in just to finish this off?
No, it's okay. I think it was in relation to Councillor McHugh's point, but I think Peter's going to pick up separately anyway, and I'll probably kind of cover that. But I see Martin's got his hand up as well. So. Okay,
Martin, finally.
Thanks, Chair. Just to say, Peter, an excellent report as always, but I'm just a bit disappointed in the fact that carers are not being seen as an identifiable separate group. They've been seen, within the report, they're seen as being add-ons to children or to disabled. It would be nice to see in future versions of the report that carers are seen as an individual identifiable group within the report.
Yeah, the reason we refer to it that way, Martin, is that when the Scottish Government identified their priority groups who were most vulnerable to child poverty, that families that had a degree of caring would be one of those. But that's not the only way that we consider the support and the relationship with carers. So maybe I think we'll have a look at it and see how we can pull that out more effectively next year.
And thank you very much indeed, Martin. And Peter, thank you so much. This report is for noting, so we're content with that, and we'll look forward to the next update report. And just a final question, to what extent will the IJV be involved in the next iteration of the city plan?
Well, Catherine's the brains behind most of the stuff we do in the partnership, so I suspect that we'll be working very closely on that.
Thank you very much indeed, Dave.
Yeah, I think just on that, and you know, as both our plans in terms of the IGB's plans and the city plans develop, there is that kind of connection between the two. So you know, as we develop our kind of strategic plan for the IGB, there'll be things that are then shared, and Peter and his team will pick things up. So we've got that kind of whole system representation on our strategic planning group within the IGV. So it's not like they're done in isolation. There is a connection there.
No, I mean, I was being flippant there, but the work of the SLG in particular, which pulls in the thinking around health inequalities, is a really significant bit of the partnership's agenda. And I think we're going to, we've got a long track record now of trying to do the right things and probably not making the progress that we would want. And we would absolutely want to know that the Health and Social Care Partnership were having their agenda reflected within the city plan, but we're also maximising the role that they can play in helping us to achieve the goals across the whole city plan.
Okay, thank you. And I noticed some information in the chat, some further questions. Can we just gather these, please, these questions, and feed them back to Peter, if that's okay? So, because there is quite a lot of interest in this work. And Dave, just reflecting, we were talking about Linlathen, that project, I think it would be quite useful at some stage for the IJV board to actually have a sight of what that project is doing, because I think it's got a lot of useful indicators of how things could be done in future in terms of work, because I think it's certainly well worth celebrating, I think.
Yeah, happy to do so. And I think Councillor Short picked up on the whole family support side of things as well, which is that next kind of almost iteration of that. So we can bring something back in due course about that.
Thank you very much indeed, and thank you, Peter, and thank you. Okay then, thank you, Peter. Arlene, do you want to introduce the next piece?
Yep, so that then takes us back on to item 4, which is Dundee Health and Social Care Partnership Performance Report, and it's for noting.
Thank you. And I've got my notes here and I can't find them in terms of who's leading on this for us today. Oh, it's Lynn, isn't it? Yeah. Hello, Lynn.
It's myself, Bob. Thank you very much. Okay, so the purpose of this report is to update the PAC on 25-26 Q2 performance against the National Health and Wellbeing Indicators, the measuring performance under integration, or the MSG indicators as we call them, and also data is provided in relation to social care demand for care at home. So as we've previously discussed, there's still significant variation by LCPP, with the poorest performance in many of the most deprived LCPP areas. As you know, the 2021 baseline year, that's our formal baseline year as per the legislation, but given that was during the hospital emergency footing period, we've also provided 2018-19 data as well. So looking at what the data, the key points from the data, emergency admission rates are still high. The rate is poorer than both the 18-19 and the 2021 baseline years. So when we're looking at 2021, there was an increase of 20.1%, and that equates to 2,863 more emergency admissions. There's still significant variation by LCPP, and if you look at West End and East End, East End has double the rate of West End. Bed day rates, that's not such a concern in my opinion. Trend, the rates are 9.1% poorer than the 2021 position, but 12% better than the 18-19 position. So that really is reflecting that the hospital closure and emergency footing in 2021 for the reason for that that difference. So there's also poorer performance at both baseline year and the 18-19 position in the 28-day readmissions, and they were by 3% and 4% respectively. Admissions due to fall was 33% worse than the 18-19 performance and 1% better than the 2021 performance. So again, reflecting that sort of emergency footing in 2021. There's improvements in the standard bed days, lost to delayed discharge rate for over 75, across both baselines 1819 and 2021. And there is an unscheduled care paper on the agenda, so we'll be able to discuss that in more detail when we come to that paper.
I'm happy for you to stop there, Lynn, and just take questions on this, actually, because the paperwork is fairly clear. So unless there's anything you want to really draw our attention to out of this, quite a wealth of information here, and then I'll move to questions. So do you want to just finally encapsulate what you'd like to end upon?
That was the end. That was the final point to make.
That's even better then.
Yeah, I obviously didn't summarise the social care, but that's okay. That's all sort of detailed there, and I don't think it's of significant sort of anything significant to say about that compared with previous quarters. So happy to take questions.
Right. Okay. Happy to take questions now. It's a bit, yes, I think you've stopped them all there, Lynn. God, even Dorothy hasn't asked a question. That's really, that's fascinating. One of the things that, just as a reflection on this, and it's not a criticism, is that there's such a wealth of information here that sometimes I find it difficult to know what to focus on. And I just wonder, you know, when I was looking at other papers, and there's a kind of narrative that chunks down what it is you really need to focus on in this paper, because there's so much that comes out of this work. And it's almost like exception reporting. What are the exceptional issues that we need to focus on here? Because when you go down through the appendices, it's really quite a tough read, actually, going through all of that. So anyway, just as a reflection, I'm not asking you to answer it, but I'm going to take Dorothy and then Lynn. Dorothy.
Just as a response to that comment you just made, I do think Lindsay does a good summary, actually, within the report. I've spent hours at previous meetings, before previous meetings, going through the detail of all this information. But now I find it's useful to look at Lindsay's summary, because what she's doing there is just pointing us to the main, the important things that we should divert our attention to. So I think the layout of this is really well done. Thank you.
And I think my point is it's a so what question. And I think it's kind of like, we got this information, so what? And I'm happy to have that as a discussion offline as well, Lynn. But thanks, Dorothy. You're right. There is a wealth of good information here. Lynn.
Yeah, I just wanted to clarify. Is it Lindsay or is it Lynn?
It's Lindsay.
It is Lindsay. Okay. All right. Just I wasn't sure if I'd maybe missed a beat and you had a name but went by another one, but thank you.
Okay. I'll answer to anything.
Okay. Are there any further comments on this paper? Sounds as if there isn't. So there are a number of recommendations here from 2.1 to 2.4. Are we content to accept these recommendations?
Mm-hmm.
Thank you. Thank you, Lindsay.
You're welcome.
I'll get your name right next time. Thank you so much indeed. Okay, thank you, Lindsay. That then takes us on to Arlene.
That's item 5, which is the Clinical Care and Professional Governance Assurance Report, and you have this for a decision.
Thank you. And Matthew Kendall's leading on this. Matthew.
Thank you, Chair. So I report the Clinical Care Professional Governance Report, which we're offering for a reasonable level of assurance, as outlined in section 2.2 in the report. There are just 3 or 4 bits I just want to highlight for committee members. The first one at section 5 at A1 and community mental health and learning disabilities. Our clinical and management capacity continue to be main risks, but the management capacity in particular is a large risk for us at the moment, with a combination of vacancies, but also a combination of some sickness absence for our senior managers. So that is proving to be a very challenging area for us at this time. The organisational change process that has started for the change to the model of care transformation work to a single mental health system has also slowed down some of the recruitment that we wanted to do into that system. So we have got measures in place where we're starting to look at how we can manage and mitigate that, with other managers providing support to those teams, but it does continue to be a risk for the system. And you'll note just underneath there, the absence of the clinical lead post further compounds that. The psychological therapies section, this is in relation to the referral to treatment 18-week target. We're put under enhanced support measures with the Scottish Government. In April of 2025, our performance, which should be 90% is the target, was sitting at 71.4%. That has risen by November to 78.4%. So a 7% improvement. And I understand that that puts us above the Scottish average now, where we were previously sitting below that. So there's some improvement there within that service. There is a small and consistent downward trend for those numbers of people waiting more than 18 weeks and 52 weeks. And that's largely due to the continuing demand that's placed within that service. There are 18 aggregated specialties that are being measured within there. 9 consistently meet that target. 3 are performing in the 80 to 90 range, and then 6 are sitting out with that at this point in time. And they're the higher volume specialties. There's a fair bit of recruitment that's gone on that's helped us meet this position, but more recent recruitment should start to move us to a position by the end of March and June to see more of those teams meet that standard. The next point was it's a positive point in terms of our community alarm services on page 45. The community alarm services have been awarded the Platinum Award by the Scottish Government, and this is in relation to the successful completion of a 7-year journey that we've had to move from analogue systems to fully digital pathways. And the Platinum Award is the highest possible recognition for digital transformation. So I just wanted to bring that to the attention of the committee, because that's been a long and challenging journey for that team, while also providing services still. And then the last point that I just wanted to make in relation to our ongoing challenges with managing our historical adverse events. The figures show that we're in a relatively static position with that. We have identified project management support now to provide a bit of guidance and support for our mental health teams in particular. We're hoping that this is going to help with providing a more transparent and a more efficient way of using our existing systems, our dating system where all of this work is managed, and our project management support is just started in the last few weeks to help the teams in managing that in a slightly different way. So it's just to say that we are continuing to work on that and recognise the challenge that we've got in that. So that's all I wanted to say. I'll pause for any questions. Excuse me.
Thank you very much indeed. Questions for Matthew? Dorothy.
A comment, first of all. I see there's a reference to the roof at Kingswick on this report as well. Matthew, a new current risk on page 42, the emergency call alarm system at Roxburgh. Are there any proposals to replace this system?
At this point in, Angie is the manager for this area. Perhaps Angie, do you want to come in on that one?
Thanks, Matthew. Yes, Dorothy, at the moment they're trying to do a final check to clarify, is there any way of getting parts for the system across the UK? And once they've excluded that, they will have to look at going to some form of procurement process to replace the system. But it is a lengthy process and it is quite costly.
Thank you.
I'm looking for further questions on this. And I'm just mindful, Matthew, of the current and emergent concerns that you have within your paper here. And clearly the issues around about psychological services and recruitment have been an ongoing issue here. And I think we're well cited on that, but I think it's worth noting when we come to the reassurance around this paper here, and particularly the leadership. With the changes that are happening within the overall approaches to our mental health services, Matthew, do you see those changes actually helping to support the work you're doing here in Dundee?
I think bringing all of the mental health services together so that there can be consistency, shared learning across the whole of Tayside. I think there are opportunities for that to show some improvement. I suppose we need to be mindful that the integrated nature of the work that we provide is supported, and that we continue to make sure that we engage with that and support that as we move forwards. Because what we wouldn't want to see is a separation of the health and social care teams that have done such a good job over the past few years.
Mm-hmm. No, I agree with you entirely. I think that's what the name of the game is, moving ahead. Thank you so much. I was pleased that there's a new director coming in March, I think, something like that.
Yes.
So that's really a great step forward. Are there any further questions from Matthew before I move to the recommendations? Okay, Matthew, thank you for a very helpful report. So the recommendations are to do with the level of assurance provided is reasonable, and to give a number of factors there, which I won't go through. Are we content that this provides a reasonable level of assurance?
Yes.
Thank you very much indeed.
Thank you.
Thank you, Matthew, and look forward to your next report. Thank you. Arlene?
Thanks. That takes us on item 6, Drug and Alcohol Services Indicators 25-26 Q2. And you have it for noting.
Thanks very much. And this has been introduced by Russell Wood and Lindsay again. Thank you.
Hi there. Okay, so I'm going to make a start. So the purpose of this report is to update the Performance Audit Committee on performance of drug and alcohol services. So I have 5 key points regarding data, and then I will pass over to Russell to give the operational services reflection on the data. So in terms of what the data is telling us, there's been an increase in the number of suspected near-fatal overdose incidents reported by Scottish Ambulance Service, and that increased from 192 in Q2 23-24 to 270 at Q2 25-26. So remember, the data in this report is rolling, so the data for a quarter is reflecting the whole year, so the current quarter and the previous 3 quarters. So the Tayside Overdose Prevention Group has established a working group to refresh communication, harm reduction strategies and training, supporting the response to this data. So the next point is the proportion of people who started treatment within 21 days of referral has remained high. This ranges from 89% to 94%, and the waiting time standard has been met in the last 4 quarters. There's been an increase in the number of alcohol referrals since Q2 24-25, rising from 453 at Q2 24-25 to 580 at Q2 25-26. Referrals to drug treatment services have declined, and it's currently sitting at 486 at Q2 25-26. And the numbers of people starting drug treatment has also fallen as well. And finally, the number of alcohol brief interventions decreased by 41% between Q1 24-25 and Q2 25-26. So these are the main points that I pulled out of the data as a summary. Happy to take any questions now or pass over to Russell to provide the operational narrative, and who could also provide questions regarding sort of the trends in some of this data from an operational perspective.
Lynn, do you want to come in before I move to Russell?
No, I'll just hold my powder till Russell's done his thing. Thanks.
Okay, thank you. I'll hold that then. Russell.
Yes, so just to pick up on one of the data points in terms of the alcohol brief interventions, there is a change from Public Health Scotland in terms of the information they're gathering. They're not gathering the information in the way that we're reporting. They're doing a review So at the moment, we'll continue to monitor and support the process around training to ensure that we've got a GP supported in terms of the work they're doing. So we'll continue to monitor it. It should be seen almost as business as usual with our GP colleagues. There are other specialist areas that we also support in terms of gathering data around alcohol brief interventions. We're very much waiting to see what the new reporting schedule and demands will be from Public Health Scotland. Until that time, we'll look at our own performance and try to ensure that we're supporting those that are providing that work. So I hope that clarifies that point. In terms of other information I'd like to highlight, it's on page 55 in terms of 7.1. So it's again to note that there is no waiting in terms of getting people into treatment under the MAT standards work. Particular parts of the service have been put forward for Healthcare Scotland awards. So we had a winning team in terms of the primary care work that's been done under MAT Standard 7. So they were the winning, but another finalist was the wider DDARS team. So it's good to note that we are being highlighted in terms of how we're managing substance use. That was the category. In terms of 7.4, it's just to say that we are awaiting a review of our residential rehab pathway. So the ADP's commissioned an independent review. We're looking to use that review and recommendations, and we'll feed that back in another report. But it was just to note that that is an ongoing process at the moment. And then finally on point 7.7 is around our multi-agency consultation hub, which is the mental health and substance use hub that includes third sector and statutory services around substance use and mental health. So that's a weekly meeting. Again, we were asked to present how that was going at a Health Improvement Scotland event in terms of transforming mental health, and we were seen as quite a leading approach in Scotland, one that other areas are looking to incorporate into their own work. So that's all I wanted to highlight.
Thank you very much. Thank you very much indeed, Russ. A lot of good stuff in there. Lynn, and then Dorothy.
Hey, thank you very much. I do have a couple of questions and a point. First question is in 4.3, there is a note made of expecting mothers during the Christmas holidays or just the run up to it. I was at Cowan Place dropping off some supplies from my local community group, nappies, wipes, etc., and a few bits of toys and things. And I'm just looking for clarification that although it is a Scotland-wide unit or a northeast unit, that we are actually using it as a city to its full advantage. It's an incredible place, but are we taking full advantage of it with it being on our doorstep? And if not, why? In 7.3, the cocaine brief interventions, and I'd really like to see something specific about cocaine in the city. It's whether it's crack cocaine or whether it's Sunday afternoon at a football match or going into the pub, you just see a line going backwards and forwards. Alcohol isn't the same use in pubs nowadays. You can see it in the city, and I really worry about the cocaine use in the city. The only reference I've ever seen to anything about cocaine use, again, is in my local ward, and it's in the ladies' toilets in Arthur Stone Library, with a number for DVVA if you want to talk about your cocaine use. It's really rife in the city, and are we in a position that we are taken it at the extent that it should be taken, because again, using my age, I remember in olden days when we used to have posters that showed you what cocaine would do to your heart, and I think if you go into A&E, the doctors there will tell you that they're seeing different things presented because of it. And finally, and there's not that many people left for me to have a moan about, but Martin will hopefully back me up. DDARS, is it still open doors at the bottom of Constitution Road? Because the trauma that's associated with that building it isn't going away, and we might have a wonderful new underpass, a new car park, but you go in that building, you're still going in the same building whether you're staff or you are a service user. So a wee suite of questions there, please.
Russell, I think you want to lead on those?
Yes, so in terms of the mother and baby unit, yes, it's a Scotland-wide, and we would refer into that. They sit on the number of services we can refer to for residential rehab and for support. So absolutely, we would, if we had someone we can refer into that, they'll have their own weighting because it's such a small resource for a Scotland-wide approach. So in terms of cocaine, yes, we're developing a pathway. We've had we've had two pieces of work. Public Health did a needs assessment around cocaine. That's from a few years ago. We've updated that and we've developed a brief intervention training. We're at the moment working in a multi-agency, a multi-service approach to mapping out what we need to do to support people using cocaine. There are two different approaches we're looking at. The first one that will go out will be for people using powdered cocaine. As you say, that's got a number of different aspects to it, but it's the most visible use of cocaine in the city. Then we'll have a longer time to develop an approach around crack cocaine. We are going to have a study in Dundee where it's a multi-centre study, but it's looking at using medication to try and, instead of using crack cocaine, we'll be providing a medication to substitute. So again, that trial will be going on either later this year or the beginning of next year, but we've been agreed as one of the centres across the UK that will do that study. Sorry, I'm lost my train on your third point. That was in regards to
Constitution House.
Constitution House, where we see people across 12 or 13 different clinic sites. We have to use Constitution House because especially for the dispensing of medication, and a lot of people come in for that purpose in itself. That's because we need a Home Office licence to oversee that, so that we can't get around that. In terms of other aspects of it, we are running a community programme for alcohol in Constitution House as well, because that needs a set of rooms that we couldn't get in any other area. It previously was running in Lochee prior to COVID. We're hoping to move that out of Constitution House once we can get some other viable space. So we recognise the issues. One thing that we've agreed with the ADP is to finance reach advocacy, to do a bit of work about how people come into the service, but it will still require the use of Constitution House at the moment because we don't have enough space to see the amount of people. And then obviously I've said about the medication. Last point on that is we're about to do a test of change around giving people their medication in the pharmacy, the injection that we're currently having to do in Constitution House. We're going to do a project with 3 different pharmacies where people will be able to access it there. So we are trying to move treatment out, but it's a long process. But I take your point, and we don't want to stigmatise anyone.
Thank you for that, Russell. And Dorothy, and then Dave.
Thanks, Russell. Could I just, before I ask my question, pick you up on something that you said there in your response to Lynn's question about cocaine brief interventions and a pathway to be developed. Where are we with that? What is there a timescale for the pathway?
Yes, so we've had some meetings. We're getting support from Julia Martinoff, who's a project manager within primary care. So I would reckon we will have a pathway that's visible for all services to actually work towards within the next 3 months. We're already doing the work. It's just not well communicated in terms of who's doing what. So that's the piece of work. It's not that we're not, services are not able to do the work. It's just we don't have a clear pathway of who to refer to for what problem at the moment.
Okay,
So
thank
that's
you.
what we're
Thank you.
working on.
Thank you. That wasn't my question, actually, but thank you for that. 6.5 in the report talks about a significant reduction in alcohol brief interventions. Now, I'm not sure, is this good or bad? Is this good news or bad news? And what's the reason for it? Do we know?
I'm not sure about the reason for the reduction, but I think what we would hope is that we continue to use this as a process that becomes business as usual. It takes a lot of training, and we've got one person that's doing that to keep people with the knowledge and skill, because a brief intervention uses psychological approaches and they need to be supported regularly. So I don't know if what we're seeing is a lack of people reporting. So I know we've had issues in the past around GPs ticking the box to say they've done it. So I'm not sure if it's happening and we're just not reporting it from primary care, but I'm happy to take that query and ask public health and get back to you around that.
Thank you so much.
Thank you, Dave.
Yeah, no, thanks. I just wanted to kind of comment on just a couple of points, and Russell's kind of covered kind of most of them. So I think the first one was around kind of the Constitution House kind of issue that Councillor Short had picked up, and as Russell points out, it's not the only place that we provide that support. It's kind of community wide. We are kind of still working with the NHS Tayside and Dundee City Council kind of property in the estates to identify suitable alternative property, and we're working with and that's been kind of facilitated by Scottish Futures Trust to kind of look at how we can provide both substance use and mental health facilities across different aspects of the community. So so that work is ongoing, and we should come to conclusion on that over the coming months around that. In terms of the cocaine issue, I mean, again, Russell's kind of provided a good overview. And that's something that the ADP, in terms of with the kind of responsibilities ADP has for that strategic planning oversight as well, will kind of pick up as well in terms of the kind of different partner drug use across the city as well. So that'll kind of form part of that. And just finally, I'm not opening my hand up, but just because Councillor McHugh kind of picked up on it, was in terms of the ABIs. That question has been asked not just within Dundee, but I think across Tayside. So it seems to be a pattern across the whole of Tayside. And certainly kind of one, as Russell said, it's, whether it's around to do with recording or whether there's actually a reduction in number, that question's been asked and kind of looking back into it. But it's Public Health Scotland information, so we're kind of looking at how we can get a deeper dive on that. Thanks.
And thanks very much indeed. I just wanted to highlight, I think there's some really good pieces of work here, and just looking at 7.1, for example, I do think we're doing exemplary work around that standards. Actually, I think we should highlight that. Also, I've just really, and I think Lynn highlighted the issue around about cocaine, and there's another bit further down where we're talking about the MAC stuff, the multi-agency consultation hubs, and how interested the Health Improvement Scotland were in this work. It strikes me, Dave, is that it might be useful. I'm trying to think. When does ADP create an annual report around about work to the IJV?
I'd have to go back and check the sort of timescales. Catherine may know, so I'll defer to Catherine.
You get two reports from ADP, Bob. So actually they go to the IJB. The IJB signs off jointly signs off the ADP's annual Scottish Government return. I think that normally happens around August time. And then you get further information as part of the Composite Public Protection annual report. That's usually kind of September, October time.
I'm just thinking about the issues that are raised here are quite complex. I'm thinking about service users, and we've got the drug-related deaths, we've got mental health issues and alcohol, and all of these are intermingled here. And picking up Lynn's real concerns around about cocaine use in the city, it kind of strikes me as that we need quite a useful kind of like, although they were doing a presentation to us around the ADP, it'd be useful if we have a decent kind of development time round about this as well, because there's a big focus nationally on what Dundee's doing, and I think there's some good things that are happening here as well. And I'd like to, rather than just looking at all the negatives that are there, there's certainly lots of them, but I do think we need to have a more rounded discussion at IJV level on this work in general. And I would find that quite helpful as a board member on the IJV, and wondered if we could look at what's the best way of doing this, how we could engage it as a highlight event rather than just looking at it as a report. And I'll discuss it further with you, Dave, but it does strike me as there's some really interesting stuff here that others nationally are looking at as well. Okay, this, I don't see any other questions, so I'm trying to move that to the recommendations. So we're asked to note the data presented in this report and the ongoing improvement activity in section 7. Do we just acknowledge that? Thank you. Excellent piece of work, by the way. Thank you. That takes us now, Arlene.
That takes us now on to item 7, Mental Health Services Indicators 25-26, quarter 2, and you have it for noting.
Right, thank you very much. And that's Dave, that's yourself, supported by Lindsay yet again. Thank you.
I think we'll flip that. Lindsay will do the lead, and I'll pick up on anything else. Thanks.
Thank you very much. Thank you. So the purpose of this paper is to report the suite of measurement relating to the activity of mental health services for both scrutiny and assurance. So we've already touched on this, but this is the first performance report which we are reviewing in sort of line with the actions from the action tracker, aiming to ensure that the narrative that we provide is really closely linked with the data and the trends in the data as well. In addition to that, we want to ensure that the level of data that we're providing to the PAC is appropriate for the PAC and is useful for you to meet your statutory functions. And we also want to ensure that the indicators incorporate the recently approved Tayside-wide mental health and learning disabilities indicators as well, around the enhanced waiting times target. So these include, for instance, average length of stay, bed occupancy, community mental health waiting lists, emergency mental health readmissions within 28 days, looking at psychiatry of old age, general adult psychiatry and learning disabilities as well. So as we've talked about, it's a sort of an iterative developmental process as we improve, but we're hoping that this will start to be seen from the next performance report. So in terms of what the data is telling us, I'll summarise some of that and pass over to Dave. So emergency admissions for mental health, there's still significant variation across our localities, but particularly in Lochee for the 18 to 65 age group. Decrease in mental health bed days across both age groups, and again, Lochee significantly higher for the 18 to 65 age group. East End significantly higher than the other LCPs when you look at the older people, the 65 plus age group. Steady decline in referrals to psychological therapies since Q4 23-24. Lochee and Coleside having the highest number of new referrals. Referrals to the community mental health teams have steadily increased as well. The number of referrals to psychiatry of old age has remained steady, and the average number of return appointments is 11. Referrals to learning disability services have gradually declined, with the highest number of new referrals in the Strathmartin area of the city, and the average number of return appointments there was 15. There's been an increase in both local authority and private guardianships. Emergency detentions in hospital have remained stable. However, the number of compulsory treatment orders have decreased. So they're the main points from the data. Happy to answer questions. I'll pass over to Dave. Take questions at the end.
Yeah, thanks, Lindsay. I think we've covered kind of everything there. I think from my perspective, and looking at the trends across a range of kind of areas, as we are starting to see a little bit of a kind of decrease in terms of referrals to a number of different services, which is starting to kind of ease a lot of pressures. I think we've kind of flagged up previously around some of the challenges within mental health and learning disabilities, particularly kind of post-COVID, but kind of probably more specifically mental health, I should say. So it's kind of, there's a little bit kind of kind of light at the end of the tunnel that I'm seeing around this, as teams try to kind of continue to work through their caseload and manage. We've kind of previously mentioned around psychological therapy, so I'll kind of not say about that just now because we've covered that already. So yeah, we'll go for questions.
Thank you. Lynn.
Thank you, Chair. My question is really around the 61 children on the child protection register that were placed on, and a third of them was due to the mental health of their parents' carers. That's really quite a shocking fact, and it's worrying. And I just wondered, locality based, is that it's difficult to drill down specifically, but is that in line with the sort of other indications from across the statistics, or are we looking at something like the whole family wellbeing sort of project kind of bringing out some of these areas?
So I don't know, Lindsay, do we have kind of the data that kind of drills that down further, or is it?
No, I don't, and this isn't my sort of expert area, so we'd have to go away and find out a little bit more about the sort of the spread across the city, and discuss with people about to sort of answer Lynn's question there.
Okay, yeah. It was just to see if there's a correlation, and if we had put something in place that's going to help support that. You know, if they're all sitting in West Ferry, then that's an issue if we're concentrating in Linlathen and the northeast. Thanks.
Thank you. I think we'll just make that an action point, Lynn, and if the committee could also be informed as to that information as well. Thank you. Further questions?
Martin's got his hand up. Oh.
Hey, I can't see him on my screen, but never mind. Martin, come in.
Thanks, Chair. Very interesting report, this, but I have a couple more questions. Do we have any data to suggest any impact or Hope Point has had on the mental health figures? I noticed in the report that Hope Point was not mentioned at all, so I just wondered if we're being effective in that aspect of the operation. And the other question is around What's the other question? Do you know what? I can't remember the question. I'll just take that single question.
I'll just
Dave,
come
do you want to
back on that, and Lindsay can kind of come in as well if there's anything else. I mean, we've had kind of quite a lot of kind of good statistics around the impact of Hope Point, because absolutely certain there's nothing included within this report, and it's something we could provide in terms of we do get regular statistics from the service. And I can pick up with Lindsay around how we might want to kind of set that out within the context of this particular report, given the impact that we certainly see, but sits along here and we've not kind of incorporated in there. So we can pick up on that with Mark's good point. Thanks.
So does that mean, Dave, would you expect to see that in quarter report 3? Some update on that?
I'll pick up with Lindsay and we can confirm what might be appropriate for timing that. So thanks.
Oh, okay, Lynn.
There was a comment and a suggestion. Martin, if it's any consolation, I was actually out in Fintry last week with my communities hat on, and they were talking about opportunities that are available for people that had issues with their mental health and well-being, and it was unanimous around the table that Hope Point was there and it was serving the city. So that was really good to hear that it's now sort of within the DNA of the city, because it's Dundee third-party referral. That's where you really know you're winning. And the other thing was that as a local councillor, and I don't know if we all get this, but Hope Point send me over their quarterly statistics. So maybe it's something as easy as that, because Penumbra, I'm sure, are really keen to see that going. So it might be that the IJB just need to be added as receivers of that, Dave, because I think it's really, really good information to see.
Thank you for that.
Thanks. Sorry, Bob. I think that's helpful, Councillor, so we can feed that back.
Okay, are we content then to consider the recommendations to note the items in 2.1 and 2.2 in terms of this report? Yes, thank you. Thank you very much indeed, Lynn. And that then takes us to the next one, Arlene.
That's unscheduled care and it's for noting.
And Lynn Hornland is leading on this.
Hello, thank you, Chair. This is just a report to ask the committee to note the current position and the improvement actions related to the management of delayed discharge. This is our quarterly report. We're asking PAC to note specifically the impact of the potential financial pressures and reduction in service around social care, particularly on our continued ability to perform at this sustained level. The report outlines strategic governance structure and the performance measures agreed both locally and nationally. At the end of the report, you'll see that I've listed some of the key improvement plans designed to sustain performance, both ongoing and planned for the future. So we continue to perform very well in relation to the national position. Bed days lost are almost 4 times less than the national average. Dundee continues to show improved performance against a deteriorating picture nationally. Average length of delay for under 75s remains higher than our over 75 rate, and that's been a consistent thing and reflects the complexity associated with discharge planning for our predominantly mental health and learning disability population in Dundee. And really, because this is for noting, all I would say is that we'd ask the committee to note also that the majority of patients, and that's 99%, continue to be discharged without delay. Thank you.
Thank you very much indeed. Questions for Lynn? Lynn, thank you. Could you come in?
Yeah, of course. I guess it's probably just to say, well done. I've never picked up the local newspaper and said Dundee is right up there with the people who do this very, very well, and it's so disappointing. You know, we're at the bottom of so many leagues, and so often we get kind of played down, but we're doing something really, really good here. Now, I understand that it doesn't come without its potential issues. I believe that it's very much something that hits the local purse, but from the point of view that these statistics are our families, relatives, those we love, I think it's just got to be pointed out that it is phenomenal to see where we come across the Scotland-wide statistics, and just really well done to everybody, and thank you on behalf of those of the city for the work that's been done in this area.
Thank you for that. I think you've just taken away my chair summarising report about this report. Lynn, thank you so much. And again, Lynn Warman, I think this just demonstrates yet again how well we do in this area by comparison to the rest of Scotland. In fact, we can say that generally across Tayside, actually, full stop. So I think we note this, and thank you.
Sorry, Bob.
There's a lot of hard work goes into this. Dorothy, I see you now. Sorry.
Yes. Okay. Just to reiterate at Lynn's point about, you know, the great work that was done to reduce delayed discharges. But if we note in 3.2, to do this, we overspent our budget. And that has to be resolved because it's budget time for the IGB. So this just gives board members pause when we come to consider our budget. We did a good thing. We overspent our budget, but we did a good thing by doing that. But that can't continue because we don't have the budget to cover it. So caution here.
Thank you, Dorothy. Point well made. Lynn, do you want to finish this off before I move to recommendations?
Please, just one last comment, because I know, you know, obviously the budget considerations are ongoing just now, and I have a national role as well in terms of leading the Discharge Without Delay collaborative, which is learning for other boards and partnerships around how we've achieved this in Tayside, and is supported by the Scottish Government and other bodies. And I would just ask in the considerations that our plea this year is for the committee and other influencers to recognise that not sustaining this performance is actually going to cost the whole system more money in the long run. And it's that looking at things on a budgetary basis without divisions that will allow the whole system to actually spend more appropriately. And I know that I've made that point before, but I just feel that I always have to say it.
Thank you. And point well made. And I see that Sanjay is nodding his head sagely as well. We know what the implications of not doing this work right. It's got massive implications and cost implications for others. Thank you very much indeed, Lynn, and very encouraging report. And we note the current position and the improvement actions. Thank you so much indeed. Thank you. Arlene.
Thanks, Chair. So we've already had item 9 considered. So that takes us on to item 10. Our promise 23-26 annual report. You have this for a decision.
Thanks so much. Glenn Lloyd.
Thank you, Chair. This report has been to this meeting before, and like the earlier report on the city plan, it has already been approved by the council at the Children and Families Committee meeting on the 27th of October. It's the annual report on our promise. I won't go into all the details, but I will say that hopefully overall members will see that it is a positive report, both in terms of the range of activity in relation to each of the 5 foundations of the promise and in relation to the outcomes of that activity. So, for instance, you'll see in the report there are improved inspection grades with the Care Inspectorate, improved audit findings following local internal self-evaluation, and improvements as well, crucially, in terms of the impact on care experienced children and young people. Understandably, though, the report does also identify some areas for improvement and some key priorities, and you'll see in the report that they include a need to continue to focus on 0 to 3s, given the importance of the first 1,000 days and the fact that they're disproportionately represented in the care system. Also, I need to continue to focus on kinship care, because children in kinship care have lower attendance rates at school than other care experienced children and young people, and as a result of that, lower educational outcomes. And lastly, also continue to focus on building foster care capacity, which has gone down both nationally and locally, and is a key challenge in terms of us ensuring that children remain in family-based and ideally local care arrangements. So I'll pause there, Chair, because I'm conscious there may well be questions or comments.
Indeed, there's plenty of information provided. Thank you so much indeed. Lynn.
I'm going to name drop Ryan McShane, who's part of the Oversight Board for the Promise. Him and I had a number of lengthy conversations, and this has been around almost as long as the IGBs and the Children and Families committees, and we're very much look at where we are and where we're going. Like you said there, Glenn, the 0 to 3 is such an important time period, but what I'd be interested to understand is, and I remember very clearly the statistics with regards to the outcomes of the 25-year-olds who were care experienced and how many would not make it to 26. And I just need to understand a little bit about how successful so far the promise has been for the cohorts that have come through, are now in adulthood. And, you know, like Ryan, a really good example, but, you know, are we talking enough about who we've kind of changed the life thresholds of? I hope I'm getting that across properly.
I think it's a very, very good question, because it alludes to the longer term impact of all this work in early adulthood, and we know from the Independent Care Review that and other research, in fact, that care experienced children and young people are disproportionately represented in adult systems, the prison system, mental health system, substance use system, etc., etc. We know that. What we also know is that nationally and locally, from the Audit Scotland report that was published last year, is that we need to get better at the data, not just for those that are currently in the care system, but for those that have left it and have moved into early adulthood. And there's a recommendation in that Audit Scotland report that we improve the data set, that we work with COSLA and Scottish Government to improve the data set in relation to those up to the age of 26. And that's something that we'll be doing, Lynn, over the next 6 to 12 months.
Okay, so that's just up to that point as opposed to beyond, because, you know, presumably, and I go back to, again, Glenn, I think you were there when we had a briefing and Chelsea Cameron came along, and she was very much, you know, part of that original conversation. And I look at how much she's blossomed, and we never want to have like poster childs of these situations, but it's where they go beyond that. And you know, as a Scotland and as a society, are we really making that difference? Not up until 26, but future generations, because of the interventions that we're taking now?
And again, I think so. And I think we also need to bear in mind the importance of usable data and capacity to actually gather that data and do something with it. So that will need to inform those discussions with COSLA and Scottish Government. But beyond that, we may need to deep dive through separate evaluation studies into children and young people that are older and beyond age 26, I think.
Thank you. Further questions? Okay. I don't see. I see Dorothy now. You've moved down to the bottom end of my screen here, Dorothy, which is why I don't see you anymore. Thank you, Dorothy.
Thank you, Glenn. Good progress recorded here. and recognition of where improvement is needed, and that's exactly what we want. You know, we want to celebrate our successes, but really our attention should be drawn to the priorities for improvement. So, and the report gives us that. I looked at the information under family section 4 on 4.4.2, which talks about finalising a review of third sector commission services, which currently involves £2.3 million of annual funding to 14 organisations. Is this funding likely to be maintained, do you think, as we go through the budget process? Or is there a risk here?
Again, Dorothy, it's a good question, and it's subject, as we speak, to the council consultation process in terms of budget proposals, which we need to make decisions on before the final committee meeting scheduled for the 3rd of March. So there is a risk. In relation to that risk, there would be mitigations, but as yet that decision hasn't been made in terms of whether or not there's any funding reductions.
Okay.
Thank you.
Thank you. I'll move to the recommendations now set out in 2.1 and 2.2. We note the continued progress, and we also remit the Chief Social Officer to provide a further update on performance in 12 months' time, Glenn. Thank you so much indeed. Arlene.
Thanks, Chair. So that now takes us on to item 11, Governance Action Plan Progress Report. You have it for noting.
Catherine.
Yeah, I'll keep this very brief, Bob, because I think the cover report's pretty self-explanatory. The only things I would add to what is there is that we are likely to take a chunk of actions off around risk. We've been doing a lot of work around the risk register, and that will be submitted to the IJB in February, which will allow us to take some further actions off the Governance Action Plan, we think, subject to your approval. And also just to say the report notes the work we've done on the work plan for PAC and IJB, and that has been helpful. We've mapped across all the requirements, detailed requirements from the Governance Action Plan into that to make sure that we don't miss any opportunities when reports are coming, for example, reviews of standing orders, etc.
Okay, any questions on this? Dorothy.
I'm not sure if it's a question or comment, but Catherine, I do note there are a number of significantly overdue actions. Now, is this to do with capacity within the team? And if it is, I hope we're all recognising the risk here. Would you like to comment? Is it to do with capacity within the team?
Yeah, there are certainly elements of that, Dorothy. They need to prioritise the chunks of work. So as the report reflects, for example, we've had an opportunity to look at the risk register and get that prioritised and get some actions off that associated with that. We'll be looking at this, obviously, through the review of the strategic plan. There will be some that come off that are associated with that as well. But it is a small group of staff who carry quite a lot of the kind of operational work that sits behind these actions. So we have to manage that through constant kind of prioritisation of that, and kind of the management of the risk associated with the different actions, and the kind of any risks that would arise from not completing those. Some are also associated with timelines for annual reviews and those sorts of things too, where we can't review something. There's some about the integration scheme, for example, which NHS and Dundee City Council will review. I think next year it's due. So there's some that are associated with those sorts of things too.
Dave, do you want to just finalise?
Yeah, just that. Yes, that's that. Thanks. Yeah, just that. I mean, Catherine has covered the majority of things. I think the other thing is there are other elements within here that we are reliant on other people. So Catherine did kind of note about things like the revision of integration schemes, etc. So there are things that we've kind of put out and kind of asked for some kind of work to be done, but recognising that there's kind of whole system pressures that need to be recognised. So as ever, we'll pick up with our internal audit colleagues around any areas within this that are becoming an area of significant risk to our governance. And I think that oversight around our governance arrangements becomes probably is more important in terms of some of those actions. So if Barry and his colleagues kind of pick out, well, because you've not done X, Y, and Z, then this puts a governance risk in the system, then that's what we'll respond to in terms of priority.
Thank you. Lynn, and then I'll finalise.
Okay. My question is regards the fact that this is 1/3 of an equation that NHS Tayside does with 2 other local authority areas, and maybe this is not something that you can answer at this stage, but I know that we've got closer relationships, for example, with Angus now, with regards to our scrutiny and audit committee, which is this afternoon. Is there sort of not a copy and paste, but is there lessons to be learned from the other IGBs within the family of NHS Tayside with regards to this?
Catherine, I'll take you first and then Dave.
Yeah, certainly, because there's lots of things where we learn and share from one another, and actually the risk register and the work around the risk management kind of guidance is a good example of that. So there'll be a paper submitted to the IGB about that in due course, but actually we've based what we've done here on the arrangements in Perth and Kinross because they were much more advanced and we were able to take that and learn from that. So we certainly are sharing and picking up where we can and not duplicating and reinventing the wheel, because similarly Angus and Perth and Kinross have pressure, so where we can share and learn from each other, we make sure that we do that.
Great, thank you.
Dave.
It's fine. Catherine's covered that anyway, so it's fine.
That's fine. Okay, then thank you very much indeed, Catherine. And we note the content of the report in 2.1. Thank you.
Thanks. So that then takes us on to item 12, which is the IGB Internal Audit Plan Progress Report. You have it for noting.
I'll speak to that briefly. This paper provides the committee with an update on the progress of the one remaining review from 24-25 and progress on the 25-26 plan. You'll note the report also includes internal audit reports that were commissioned by the Council and NHS Tayside by their plans. They've been included for assurance purposes to yourselves. In relation to NHS Tayside, there's actually 2 reports that were limited assurance. If the members want to read these reports in full, they are available on the NHS Tayside website under the Audit and Risk Committee papers for December 2025. And each of these reports were considered in full and separate at that NHS Tayside Audit Committee. An update on the progress of all the IJB's internal audits is shown at Appendix 1, with details provided on current activity. The internal control evaluation work, which is quite a large piece of our assurance that we provide in year, I think we've said that would be done for March. I don't think there's a March meeting, so that will be coming to the May meeting. I don't really have anything else to highlight at this point.
And thank you, Valerie. There's a lot of information in the report itself. So questions for Valerie? I didn't read that chat there. What was the question again?
It's from Martin about the links to the reports, whether we can get them sent out so that we can take an action away and take that.
So we'll take that as an action then. Thank you. I just thinking about information, and I think it was the question I meant to ask when we were talking about drugs and service user stuff, and it was the stuff that come up with the health improvement work and issues around information governance. And I meant to ask that question. I don't know if anyone's got any insight into that, but it's a question I've forgotten to ask when looking at the alcohol and drug partnership report. There was issues around about mental health and service use and information governance, and I wasn't quite sure what that was. And maybe that's something I need to, I'll do that separately. Okay, I don't see any questions coming up here. So I'm just going to go to the recommendations then. So just note the ongoing work undertaken in 24, 25, 25, 26. Okay, thank you so much indeed. Arlene.
Okay, so that takes us on to item 13, which is the attendance list, which is submitted for information. And then item 14, the date of the next meeting, which is Wednesday, the 20th of May at 10 o'clock.
Thank you. Okay, thank you very much indeed. And thank you all for your inputs. And Lynn, do you want to say anything?
Yeah, it was just to thank everybody for their patience this morning. 20 questions short was back again, so hopefully that was just a wee dive in, and I'll be back in another couple of years. But yeah, thanks for your patience this morning. It's very much appreciated.
No apologies required, Lynn, I assure you. Thank you. Thank you so much indeed. And I'll see you after the elections. Okay.
Okay.
Thank you.